Let's talk health. About 50 women suffering from BVF at the Bingham University Teaching Hospital have benefited from a free medical surgery. The gesture is to help women who suffer discrimination and stigmatization for a long time. Senior reporter Funam Joshua tells us more.
The vesico-vaginal fistula, popularly known as VVF, is an abnormal opening between the bladder and the vagina that allows a continuous involuntary discharge of urine into the vaginal vault. This distressing complication mostly occurs after surgery to treat problems in the bladder or vagina, and it happens in both young and adult women of reproductive age. The good news is that Bingham University Teaching Hospital in Jos, North Central Nigeria, is among the few health facilities in Nigeria that treats VVF. And to find out more on what and how this health challenge can be minimized or contained, TVC News chatted with Sunday Lengman, an associate professor of family medicine in charge of the Evangel VVF Center.
The problem of VVF is a part of female genital fistula that only affects women and girls. Globally, we have about 2 million cases that are awaiting surgery, but in Nigeria, we have 114,000 women with fistula, and apart from that, which we call the prevalence, we also have every year another 12,000 women developing fistula in Nigeria. So it's a very big problem.
In some parts of Africa and around the world, many women with VVF are regarded as social outcasts, and sometimes they suffer discrimination and stigmatization from families, friends, and the general public. TVC News crew was curious to know more, so we visited the VVF section, where many patients were in the sick bay.
I was having a fibroid, so I went to the hospital. They operated upon me, and then along the line they said there was a mistake on my bladder. They injured my bladder, and it wasn't funny having that situation. In the hospital there, many people were like not associating with me any longer, because if I sit down, my back will be welt, and then they will look at me, everybody were running away from me, to the extent that even my friends and family, they all ran away from me. So it wasn't funny. I was like, the whole world has turned against me. When I was feeling that the whole world has turned against me, coming to this place, I found joy. So, and after the surgery, now I feel better, I feel good, and I'm like among others now.
In a humanitarian service, a private organization decides to sponsor free surgery for 50 less privileged VVF patients and also empower 300 of them. The Plateau State Governor Caleb Mutfwang is a special guest of honor at the event.
One of the things we need to address in the coming days and months and years is to educate our communities on the need to make sure that we take responsibility for our daughters and make sure that they are not given out in marriage too early before their physical conditions can actually carry the weight of such labor.
In ensuring the sustainability of our business, and as one of the ways that we should demonstrate our appreciation is by giving back in acts of kindness.
Combating VVF needs more collaborative efforts from the government, philanthropists, and policymakers. This gesture by the donor is believed will go a long way in relieving these patients from their predicament. Funam Joshua, TVC News, Jos.